Hi, this is Anthony Fu. Today is January 1st, 2023. I'm going to give an update on Swedish model against Covid-19. In case you don't know what is Swedish model against Covid-19, and this is model, Swedes take very brief action. During the early phase of pandemic, Swedes take no any shutdown, and so life is more or less normal. There's no lockdown, there's no closed border, and the school is open, workplace, restaurant, library, gym, shopping center all have normal activity, and there is no state of emergency. Young Swedes are even encouraged to continue with the sports, training, and events. This table just showed Covid-19 cases and deaths in Nordic countries, and here we list 4 countries: Sweden, Denmark, Norway, and Finland, because these 4 countries are geographically close and also the population is comparable. And we look at 2 parameters: one is cases, another is death. In terms of total cases, Denmark has about 3.1 million, and Sweden have 2.6 million. Norway and Finland have 1.4 million. And the total deaths, Sweden have 21,000, and Denmark and Finland have about 7,000, and Norway have about 4,000. So in case of total case 1 million population, and Denmark have about 500,000, and Sweden, Norway, and Finland have about 250,000. And the total deaths in 1 million population, and Sweden have about 2,000, and that's 2 times Denmark, and about 2 times Finland, and about 3 times Norway. So it's a huge difference. And this table, this graph just shows this Covid-19 cases in Nordic country, and this accumulated cases. You can see that Denmark have accumulated cases is about more than 500,000. It's about 2 times other Nordic country. And the happening of this is that during end of 2021, this appearance of Omicron in the Denmark, and actually Denmark is the first country this Omicron is have an epidemic. As in about 5 months, about 70% of the Danish population was infected by this Omicron. It is very fortunate that Omicrons have characteristic that is highly transmissible, but they are less pathogenic. That means people will get infected by this Omicron, but they not cause any serious diseases. So that just shows this Covid-19 cases in Nordic country during the time schedule. You can see in the early they have almost the same virus, and by 2021 most viruses are alpha and beta, and because Sweden take relaxed measures, so they have a high infection of alpha and beta, and in the end of 2021, beginning of 2022, the emergence of Omicron that happened in the Denmark. There's a huge increase. Here just show this different variant of SARS-CoV-2. So in the early they have same variant, and the middle stage they have beta, delta, and these 2 viruses very highly pathogenic. They can invade into the lower respiratory, cause pneumonia. So end of this pandemic, the beginning of 2022, and this appearance Omicron turned out to be much more transmissible but less pathogenic. That means that the virus most replicate in the upper respiratory tract but not get into the lower respiratory tract, thus it doesn't cause any disease or pneumonia. And this is the graph shows the Covid-19 deaths in other countries. This is also accumulated cases. And you can see that in Sweden, the total accumulated cases is about 2 times of Denmark and about 3 times of Norway. And even so, Denmark have 2 times more cases, but in Denmark, the cases most come from later stage in end of 2021, beginning of 2022. Most virus is Omicron. So we know the Omicron can cause mild disease. However, in Sweden, because in the early stage, most cases of alpha beta coronavirus, and they cause much more severe diseases. So that's why they have high cases even so. So it's really unfortunate choice for Sweden to practice this protocol of relaxed protocols and allow people to expose to the virus. And this unfortunate choices. And so, because when we look at the pandemic, which is the most important parameter, we look at deaths. If there's no death, and I think it's fun to say that the measure you have is better. But in this case, Sweden have 2 times more deaths than Denmark, and about 3 times more than Norway, and 2 times more than Finland. And that's so if in the early stage to take preventive measure to reduce people which are infected by this alpha and beta viruses, so I think the death rate would be much lower than what they have now. So this is really tough choice, but no one will know. And this virus is really give us a lot of surprise outcome. We don't know how this virus will evolve and help that virus get weak and weak, but we don't know. But best way is that we need to take all measures possible to prevent from this virus infection. So because we don't know what kind of virus to come out next, and so we need to take measure to prevent us from infected by this virus. And we are going to continue to update on this model. We think that, but right now everything is same. But we want to see if this model really have more impact on the health, because we need to see the long-term effect, what will happen to the population. But that is really a good example of, we need to try our best to prevent this virus infection and to keep us healthy. And I'm going to continue to monitor this, and when we have results, we're going to give you more update. And thank you for your attention, and goodbye.